as it gets closer to delivery time?
Oh, very early in the pregnancy. Very much of the prenatal course is very similar to my physician colleagues. We start seeing patients out at the beginning of their pregnancy, seeing on the same, pretty much the same regular schedule as the physicians do. I have the luxury of being able to spend a little bit more time with patients during their visits because I am not busy with surgeries. I don't have the committee expectations and participation that my physician colleagues do. So I'm able to spend that extra time with the patients, a little bit more personal time, more education, focusing on prevention, etc.
Dr. Boyd, Dr. Goff has been with you since 1998. What did you know back then that was the value of having a midwife around?
Obviously, from the historical standpoint, they have been here many, many years more than physicians have. And initially, it was a political move on my part. Midwives were not well received initially in this area, even though historically they've been part of our culture. And Dana had experience. She was head of labor and delivery at Methodist prior to starting with me. And I have a very smart wife who is a labor nurse, thought that bringing Dana on board would facilitate our practice. And more importantly, not only to facilitate our practice, but 80% of patients plus have low-risk pregnancies. So they don't necessarily need a physician obstetrician to take care of them. A lot of patients go to the physician because they want questions answered, they're concerned. And from the historical standpoint of a midwife and what they offer patients, I thought it was a good connection with our office. And we've been together ever since, 16 plus years.
And I'm hearing, okay, we have a call. Okay, we have a call, actually one of Dr. Boyd's patients, and we're going to get back to the minimally invasive surgery right now. And this is a patient who had the robotic hysterectomy, and you're on the line?
Yes, I am.
Hi, good evening to you.
Good evening.
Hello.
I just want to say I last year had the Da Vinci robotic surgery. Went in the hospital at 7, was home by 1, did everything the doctor said, and was back at work in a week.
So he's not kidding us.
No, it was wonderful.
How nervous were you about the procedure itself, or just having a hysterectomy?
Not at all.
Not at all?
Mm-mm. No, I have complete confidence in him.
And were other women you know who've had hysterectomies and they saw your recovery time? Were they surprised by it at all?
Yes, I had 2 sisters that had them the old-fashioned way and were both off 6 to 8 weeks, and neither one of them could believe that within 7 days I was up running around.
That's a pretty good testimonial.
She gives a great testimonial, and oftentimes it's not necessarily the patients that you combat when you say that you can go back to work in a week. Many of our patients say, yeah, that sounds great. But when they talk to their mother or their grandmother who's had the traditional hysterectomy with an open laparotomy incision, and they say, Dr. Boyd says I can go back, I'll go home the same day. A lot of families get stressed out about that. And you can go back to work in 1 to 2 weeks. A lot of families say, this doctor must be speaking a different language, because that's not how it works.
All right, well, we appreciate the call, and now we're going to go back to having babies. Susan is on the line. Susan, good evening. Susan.
Hello.
Hi, how are you?
Hi.
What's your question?
How are you?
We're good. You?
My question is, my husband, in his teenage years, had one of his testicles injured due to fencing. And he has produced 2 children with his ex-wife. We have been married for 5 years, and I am not fixed. I've never had a hysterectomy or had my tubes tied or anything, and I've produced 2 children of my own. So, as of now, I am starting to miss my period with him. Is there any way that his tubes or his vasectomy that could reclose and impregnate me? Is this something I should be worried about?
So he had a vasectomy.
He did, yeah, but he never went in for the second testing.
Okay.
So he doesn't know for sure that it happened, but he was
Well, I'll answer it this way. Obviously, I do a lot of fertility discussion, and that would be a question, believe it or not, that I would be asked by patients, even though this is a really urological question. Vasectomies have a very high success rate. Rarely do they fail. We ask the man to get semen analysis 2 different times after vasectomy to make sure that there's no sleeper sperm. And obviously this patient does not want to be pregnant. Obviously my recommendation, ma'am, would be to have your husband have the second semen analysis to confirm to you that everything is closed. But I think you're probably safe.
Does that help, Susan? Hopefully it helps.
Hopefully
Susan.
it helps.
She's gone, but it's an interesting question. I mean, it's also, we're talking pregnancy, fertility, and it also gets into urology.
It is, and the interesting thing about our practice, when a woman has a problem getting pregnant, she will talk to Dana, she will talk to me. But the interesting thing about fertility is it takes 2 people, and it's a 40-40-20 combination. 40% female factor, 40% male factor, and 20% who you're married to. So even though the woman typically sees the physician first, because men like you and I don't like to go see the doctor, ma'am, honey, you go see the doctor and see what he says about you. So oftentimes we have this discussion frequently with patients.
All right. Well, you seem to have a very multifaceted practice going, which leads to the next question. How can I get in touch with Boyd Lowe Goff and Associates? Where are you located and such?
You want to answer that, Dana?
We're located at the Methodist Atrium, 900 East Main, Suite 660.
All right, right downtown.
Right downtown. Easy parking, open parking, easy to get to.
All right. We got Kathy on the line. Kathy, good evening.
Good evening.
What's your question?
I just wanted to say that I, too, had the total hysterectomy via the Da Vinci, and it really was a very, very easy procedure. I guess I was a little bit worried to begin with, but recovery was wonderful. I was back to work in 2 weeks, very little pain. It just was a very, very good experience. So just wanting to share that with anyone else that might be wondering or worried about using that procedure. My personal experience was that it was very, very easy. So,
and I appreciate that testimonial. And the interesting thing about medicine is, GYN and urology had driven robotic surgery across the United States. But more and more specialties, general surgery's using it, the chest surgeons are using it. Believe it or not, the ear, nose, and throat surgeons are using the Da Vinci now. So this really is our future. And programs like this where we discuss this.
It is the new standard. And while we have that, we got Cindy with a 2-parter. The first one we answered, Da Vinci cannot be used with the C-section.
Correct.
That's still a big thing. What is the risk of a Da Vinci procedure?
Well, the Da Vinci procedure is a surgical procedure.
So anything could.
Yes, bleeding, infection, injury to organs such as the intestine, the bladder. And so it needs to be approached with just like you do any other surgical procedure.
All right, Dr. Boyd, Dr. Goff, thank you so much for being with us. This has gone very quickly. We're going to be back in a couple of weeks with another Docs on Call for you on Monday, May 4th. We hope you enjoy your evening. Thank you again.
Thank you.
It's been a pleasure.